Cleft lip and palate are among the most common birth defects, affecting about 1 in 700 infants a year in the United States alone. A cleft is an opening or a split in the upper lip or gum on the roof of the mouth, known as the palate. You can see here that there's a slit in the baby's lip. The Cleft Palate Foundation, or CPF, is a nonprofit organization dedicated to optimizing the quality of life for individuals affected by facial birth defects. It was founded by the American Cleft Palate Craniofacial Association in 1973 to be the public service arm of the professional association. Usually, a cleft in the lip or palate is immediately identifiable at birth. Clefts can appear as only a small notch in the upper lip or can extend from the lip all the way up to the upper gum and back to the palate. In the womb, every baby has an opening in the mouth when it's forming, but the structures are normally fused together during birth within the first 3 prenatal months. In babies with cleft lip or palate, the fusion never takes place or only partially leaving an opening. A child born with a cleft frequently requires several different types of services such as surgery, dental orthodontic care, and speech therapy. All of these need to be provided in a coordinated manner over a period of years. This coordinated care is provided by interdisciplinary cleft palate or craniofacial teams comprised of professionals from a variety of healthcare disciplines who work together on the child's total rehabilitation. Researchers believe that most cases of cleft palate and cleft lip are caused by an interaction of genetic and environmental factors, although a definite cause may not be discovered for every baby. Genetic factors are either the mother or father can pass on genes that cause the clefting. In some cases, babies inherit a gene that make them more likely to develop the cleft, and then the environmental triggers the actual cause of the cleft. Environmental factors are fetal exposure to cigarette smoke, alcohol, certain medications, illicit drugs, and certain viruses that have been linked to the development of the cleft. Researchers believe that some clefts may be caused by nutritional deficiencies in the mother, particularly a lack of folate. The Cleft Palate Foundation focuses on the well-being of the affected individuals and families, and the advancement in knowledge through research and raising awareness. CPF has been funding research in the cases and treatments of cleft and craniofacial birth defects since 1989. To date, CPF has awarded over $570,000 in research funding. Many researchers have found that their grants provide the perfect seed money for starting a project that will later attract other larger grants that will greatly benefit the patients. They also offer teddy bears with cleft lip repair stitches across their lip. You can see here, these are the actual bears that they send out to the kids. The project aims to help children cope with the questions and anxiety that they experience from having facial differences such as the cleft lip and palate. Since January of 2001, over 10,000 children received these custom-made teddy bears, and they have brought smiles to the faces as part of the Cleft Palate Foundation's Bears for the Kids project. The feedback from the parents has illustrated that the bears provide unique emotional support for the children and help them express and understand the feelings that they have about themselves in the treatment process. These children need someone to help them out. They are born with this deformity and cannot help themselves. A lot of the parents cannot afford the operations that go along with having a cleft palate. The Cleft Palate Foundation helps the families who need the money and help them to pay for the corrective surgeries and to give the children a better quality of life. If you donate your time or money to this charity today, you can rest assured that you have helped a little kid get the normal childhood that they deserve.